last segment, we'd like to welcome back Elizabeth to help us try to better understand the future of the ACA. The new administration has, for now, pulled back its plans for ACA replacement, at least as of this hour. Let's discuss the impact of the ACA on cancer care since its implementation in March of 2010. Elizabeth, how has the ACA affected patients with chronic conditions like cancer?
Yeah, so that's a great question. I think it's fair to say that tracking ACA repeal and replace efforts are by the minute at this point, so who knows what's happened while we've been here chatting. But certainly the Affordable Care Act had a number of provisions that were very beneficial to the patient community. Certainly the ACA increased access to care, both through the Medicaid expansion, increased subsidies to make insurance premiums more affordable, and then also some really fundamental changes to the insurance market. The idea that insurance companies have to sell to anyone regardless of pre-existing conditions, that there are limits on how much premiums can vary, those were all really beneficial to the patient community. I think even as we've seen more people become insured, access challenges remain, and there are patients who still struggle to afford medications despite all of the sort of progress associated with the ACA.
How do you think, the two of you, from the physician perspective, how has the ACA changed this for cancer, for chronic conditions like cancer? So given all that we've just heard, many of those things are things that we'd looked for years. The pre-existing condition issue kept us from treating patients. I've had patients who couldn't get care for that reason. Now that that's gone, how has that evolved access?
Well, I think we're really faced with a fundamental question of whether or not access to health care is a right or a privilege, and I think that's the debate that's going on today. I think, practically speaking, though, the passage of the ACA provided access to health care to a host of patients who didn't previously have a secure source of paying for their healthcare services, and they would not seek healthcare services until later in the course of their disease. And so I think everybody's recognized that the ACA has increased access, and I don't know that we have good data that suggests that we're making earlier diagnoses, but we're diagnosing patients who might not have otherwise sought care.
So one of the elements that you raised was that of Medicaid expansion. And I live in a state that doubled down on the Affordable Care Act. So California went whole hog in this idea that they're going to expand their state Medicaid program, which is called Medi-Cal. It now covers more than 1/3 of everyone living in California. There's about 40 million people living in California, so the scale of this is huge. The exchange was and is still quite robust with about 11 plans. And then we have states like Texas who've not gone down that road, and others. So looking at this on a case-by-case basis, do you think this has improved access in those states that have doubled down or who've implemented exchanges? And have health plans been on board with these changes? How have they partnered or not partnered in that process?
So I guess I could start in that the biggest gains in terms of reducing the uninsured that we've seen as a result of the Affordable Care Act are certainly in those states that have expanded Medicaid. Right, so states like California have really seen the largest reduction in the number of uninsured patients in their state, not surprisingly because of the Medicaid expansion. At the same time, you've still seen increased rates of Medicaid coverage in states that didn't expand Medicaid, what we call the woodwork effect. So people who were eligible for Medicaid prior to the Affordable Care Act, but the outreach and enrollment associated with the law really literally had them come out of the woodwork, and now they're insured. So you mentioned the exchange market. I think that is a piece of the Affordable Care Act that has fallen short of expectations. Enrollment's probably about half of what folks had predicted when the law was passed, and that is the market that gets a lot of the attention in these repeal and replace debates. And I think we've seen this week a number of carriers announce that they are leaving that market. So while the state of California is likely to have some pretty robust competition going forward, in other states, patients and insurance commissioners and frankly federal and state lawmakers will be faced with this decision about what to do if there is no option on the exchange market for those individuals who qualify for the extra assistance under the ACA.